पंचकूला सेक्टर 6 के अस्पताल में आज सिंगापुर हेल्थ सर्विस से 3 डॉक्टरों की विशेष टीम आई। कि 23 तारीख से लेकर 26 तारीख तक 22 जिलों से आए 45 डॉक्टरों को एक्सीडेंटल इमरजेंसी केस की ट्रेनिंग देंगे। आज डॉक्टरों ने सेक्टर 6 के अस्पताल का दौरा किया, जहां उन्होंने कई मरीजों को देखा और सेक्टर 6 के अस्पताल के डॉक्टरों के साथ कई मसलों पर बातचीत भी की।
Person team from the Singapore Health Services. My name is Anantharaman. I'm a doctor from the Department of Emergency Medicine at Singapore General Hospital. My colleagues here, this is Dr. Juliana Poh. She's also a consultant at the Singapore General Hospital's Emergency Department. And that is Ms. Sharon Tan. Ms. Sharon Tan is an executive officer from the Singapore Health Services from the International Collaboration Office. We are here as part of a project working with the State Institute for Health and Family Welfare in Haryana to address the issue of emergency care in PHCs, CHCs and district hospitals in Haryana in India. We were here last year for a short recce visit just to understand better the need for emergency care, how it was being carried out and what could be done to address and to any deficiencies that may exist in the system and to help make it better. And we agreed that perhaps the process is best taken forward if we organize a training program for doctors who worked in the various emergency departments at district hospitals, at PHCs and CHCs in the management of emergencies. Now, most illnesses and injuries go through an emergency phase. And this emergency phase is usually the initial phase of that injury or illness. If we want to do good for the patient, the best opportunity is in that early phase of illness or injury when the disease is beginning or when the injury has just occurred. And if we intervene then the potential for improving the condition of the casualty is the greatest. However, unfortunately, very frequently care is delayed. Why is care delayed? Because many patients, instead of going to the nearest hospital, the nearest CHC or PHC, they prefer to go to either the district hospital or sometimes to the tertiary hospitals, which are often very far away. Travel time is also long, and therefore those hospitals become overcrowded and care is delayed. Delaying care is not good for the casualty. And that is why if we can improve the level of emergency care provided close to where people live, close to where injuries occur, namely at primary health care centers and at community health care centers and district hospitals, then good outcomes will begin earlier and members of the public can return to a normal functioning lifestyle, all right, at a much earlier time frame and continue to contribute positively to the local economy. That is the objective of the training, to provide some form of emergency care training that will help our doctors who work in the front, to address the emergencies as well as possible so that our patients, members of the public,
प्यार के लिए पंचकुला से अक्षय जादव की रिपोर्ट।